Heart attack symptoms versus heartburn. Did you know that just a 5-minute delay during a heart attack can mean the difference between life and death? It may sound distant, but in reality, every 40 seconds, someone in the US has a heart attack, and the majority of them are over 60 years old. So what makes this disease such a dangerous, silent killer? Imagine this. You are sitting with your grandchildren when suddenly you feel a tightness in your chest. You assume it's just indigestion after a meal and try to endure it. But within minutes, the pain spreads to your arm, your neck, even your jaw. By the time you realize this isn't heartburn, it may already be too late. Have you ever thought that if you had recognized these signs earlier, you might have avoided a life-threatening heart attack? A heart attack doesn't just claim lives, it leaves behind fear, the loss of independence, the possibility of relying on others for every step, every meal. That is something none of us want to face. So is there a way to recognize the warning signs early to protect yourself and your loved ones? Before we dive into the secrets of how to tell a heart attack apart from what seems like harmless indigestion, take a few seconds to hit subscribe and type 1 if you think this is a valuable topic. Are you ready to discover which symptoms may be signaling that a heart attack is quietly lurking inside your body? Have you always thought that a heart attack must be dramatic, with crushing chest pain like in the movies? The truth is very different. Many patients report that their heart attack began only with a vague heaviness or something that felt no more serious than simple heartburn after a meal. So how can you, someone over 60, tell the difference between a normal discomfort and a life or death warning bell? One of the classic symptoms of a heart attack is pain or discomfort right in the center of the chest. Many people describe it as if an elephant were sitting on their chest, making it hard to breathe. But the pain isn't always so obvious. Sometimes it's just a dull, nagging discomfort that comes and goes. And that's the deadly trap, because we tend to dismiss it. Have you ever felt a brief chest tightness and assumed a little rest would take care of it? Studies show that symptoms of a heart attack in older women are often more vague than in men. Instead of chest pain, they may experience days of fatigue, shortness of breath with light activity, upper back pain, or even insomnia. These signals are easily mistaken for aging or stress. So how can women avoid missing their body's dangerous warnings? If these signs can be so confusing, the real question is, what is the dividing line that helps you tell a heart attack apart from something seemingly harmless like heartburn? And if you make the wrong call, how severe could the consequences be?
Heart attack versus heartburn. The key differences. Have you ever felt a burning sensation in your chest after a meal and wondered, is this just heartburn, or is it the sign of an oncoming heart attack? This is the exact situation millions of people, especially older adults, have faced. The danger is confusing the two can have devastating consequences. So what are the key differences that can help you recognize the truth in time? First, pay attention to the location of the pain. In a heart attack, the pain usually appears in the center or left side of the chest, then radiates to the left arm, back, neck, or even jaw. By contrast, heartburn usually causes a burning sensation in the upper stomach that then rises into the chest and throat. Have you ever felt a pain spreading in unusual directions like that? If so, that's the moment to be on high alert. Next, consider the nature of the pain. Heart attack sufferers often describe it as if a band of iron were tightening around the chest, accompanied by shortness of breath, cold sweats, dizziness, or nausea. Heartburn, on the other hand, usually creates a burning or irritating feeling, especially after a heavy meal, when lying down, or when bending forward. Notice how heartburn often improves after taking antacids, whereas heart attack pain never fades that way. Another crucial factor is duration. A heart attack can last several minutes, sometimes easing and returning, but it never disappears completely just by resting. Heartburn symptoms, however, may fade within a few hours or after changing positions. That's why, if you've ever experienced prolonged chest pain, don't just wait to see if it goes away. Your heart may be calling for urgent help. It may sound clear enough, But in reality, many people still confuse the symptoms and they pay with their lives. So why are they so complacent? Could it be because the early warning signs of a heart attack often appear vague, sometimes hours or even weeks before the real event strikes? Early warning signs before a heart attack. Do you believe that the heart often cries out for help long before a heart attack actually hits? The problem is, most of us ignore these signals, thinking it's probably nothing. But that very complacency robs people of the golden chance to save their lives. So what are the early warning signs you should pay special attention to? One of the most common warnings is recurring chest discomfort, also known as angina. This sensation may appear when you walk briskly, climb a few stairs, or even after a heavy meal. It's not usually severe pain, but it lingers and comes back again and again. Have you ever felt a mild tightness in your chest and told yourself it would pass with a bit of rest? If so, that may not be ordinary fatigue. It could be your heart sounding the alarm.
Beyond chest discomfort, your body may show more subtle signs, such as unexplained fatigue lasting for days, trouble sleeping, anxiety, indigestion, or a dull ache in your back or shoulders. Many older women have shared that they simply felt unusually exhausted until doctors later discovered their hearts had already been damaged. Do you think you might have dismissed a fatigue that had no clear cause? Some people also experience shortness of breath, as if they can't get enough air even while resting. This is an especially alarming sign because it means the heart is no longer pumping blood effectively. If you've ever found yourself gasping for breath while sitting still, would you dare to ignore it? The most important thing to remember is that these warning signs can appear hours, days, or even weeks before the heart attack actually occurs. That means you still have the opportunity to prevent a tragedy if you listen to your body in time. So when you recognize these warning signals, what should you do immediately to protect yourself? What to do when symptoms appear and how to prevent for a healthier life. Once you recognize the warning signals from your body, the most important question is, how will you respond? Did you know that many people lost their chance of survival simply because they thought, I'll be fine if I just rest a little? That's why the very first and most critical solution is, never delay. If chest pain lasts more than a few minutes, especially when it is accompanied by shortness of breath, cold sweats, nausea, or pain spreading to the arm and jaw, call 911 or your local emergency number immediately. Would you really gamble your life just to wait and see if it goes away? Second, share these dangerous symptoms with your loved ones. Many heart attack patients are unable to call for help themselves, and it's the awareness of family members that saves them. Have you ever taught your children or grandchildren how to recognize and respond if you show abnormal signs? If not, today is the time to start. In the long run, prevention is still the key. Studies show that up to 80% of heart attacks can be prevented by lifestyle changes. A heart-healthy diet, less salt, fewer saturated fats, and more vegetables and fruits is the foundation. Are you already following an eating pattern that helps your heart grow stronger each day? Alongside that, gentle and consistent physical activity, such as a 30-minute walk each day, can significantly reduce risk. Getting enough sleep, managing stress, and going for regular checkups to monitor blood pressure, blood sugar, and cholesterol are also essential. Do you remember the last time you had a heart health checkup? The good news is, it's never too late to start. Whether you are 60, 70, or even 80, small daily changes can add years of healthy life with your family. So, what message should we carry with us now that we know how to recognize and prevent heart attacks? From fear to hope. You see, a heart attack is not a death sentence if we learn to listen to our bodies and act in time. We have traveled from fear, the vague chest pains, the subtle fatigue signals so easy to ignore, to hope, knowing that with just small lifestyle changes and by paying attention to warning symptoms, you can take control of your heart health. Do you realize that sometimes the difference between life and death
is simply whether or not you make the decision to call for help at the right moment. Remember, every minute that passes during a heart attack is priceless. But you are not alone on this journey. Doctors, your family, and even the knowledge you are gaining today will serve as a strong shield of protection. Do you believe that with just one wise decision, you could save yourself and remain longer with your loved ones? And more importantly, don't wait for the signs to appear before taking action. Start now. A healthier meal, one more step each day, one regular checkup. Each of these small actions, when added together, becomes the priceless gift you give to your heart. Are you ready to begin today? If this video has helped you recognize what truly matters, hit like, share, and subscribe so you don't miss out on life-saving medical knowledge. And don't forget to leave a comment. Type 1 if you found this information useful, or 0 if you'd like to see other topics explained more clearly. You can save yourself and those around you simply by sharing this knowledge. And who knows, one day someone may thank you for helping them avoid a deadly heart attack.